Hey everyone, I'm Chris Woodland, respiratory therapist and director of respiratory for Southmedic. Thanks for watching this video on how to use our new procedural mask, Oxy2Pro. We realized at Southmedic that procedural sedation requires an intentional solution that provides clinicians with elevated oxygen delivery capability, superior EtCO₂ capture, and an unobstructed large window for oral scoping, all in an easy-to-use, out-of-the-bag solution. Let's talk about how Oxy2Pro samples End-tidal CO₂. Oxy2Pro utilizes the power of our Oxy2 technology, which centers on the triangular diffuser inside the mask. The diffuser plays a big part in how oxygen is delivered to your patient, and that intentional delivery to the nose and mouth allows for a pathway of exhaled CO₂ to get into the funnel structure of the diffuser and then down the sample line to the capnograph. We know capnography is such an important early warning system for a patient's changing respiratory status, and so you need a tool you can rely on, no matter what the oxygen flow rate. With an improved ability to sample EtCO₂, this means as a clinician, you can more reliably trust what your eyes are seeing from the waveform on the monitor, keeping your patient safer and allowing for the possibility of a better clinical judgment to be made if a patient's respiratory status changes in the middle of a procedure. Designed for your most at-risk patients or for longer, more complicated procedural sedations, Oxy2Pro is the better procedural mask for you to choose. Better and elevated FiO2 capability, an improved means of capturing end-tidal CO₂ samples even at higher oxygen flow rates, a larger oral scope window that's more flexible and offers clean line of sight, all in an easy-to-use, no assembly required package. Because that's what we believe at Southmedic. We believe in finding a better way for you and your patients. Thanks for watching, and learn more about Oxy2Pro at thebetteroxygenmask.com. See you next time.